Dr. Bree, what are heartworms and how do they affect dogs?
So heartworms are parasites that are transmitted by mosquitoes, and they actually don't impact the heart quite as much as they impact the lung. They'll impact the heart in the late stages of the disease process, but most of the patients, when we catch them, are largely impacted by heartworm burden in their lung fields, which causes irreversible damage. So dogs obtain heartworm by getting bitten by mosquitoes. So even if your dog does live largely inside, they still can acquire heartworm. The vast majority of our patients do come from the southeastern portion of the United States. Symptoms can be as far along as congestive heart failure, but can also be limited to absolutely nothing at all. It's anywhere from they're perfectly fine and we catch them incidentally on their first heartworm test to they're starting to show some coughing symptoms. Heartworm is diagnosed through 4DX testing, also known as Acuplex testing, depending on the diagnostic lab. The heartworm test detects adult female heartworms, so it won't detect the younger stages of that parasite or the male population. So because of that, we don't go ahead and start testing them until they're typically between 12 and I would say 16 to 18 months old. The exception to that is if you have a dog from the southeast, we do start testing them anywhere from 6 to 8 months after they are transported up to the northeast. And then after that initial test, we repeat every 12 months. So if your pet tests positive for heartworm, we do go ahead and confirm with a second panel and also check for the younger life stages of heartworm. Beyond that, we'll also discuss running chest x-rays to go ahead and make sure there's no signs of heart enlargement or other concerns within their thoracic field, as well as recommend running full blood work prior to getting the ball rolling for treatment. So heartworm preventions are recommended to be given once a month. There are many products available both in topical, injectable, as well as oral routes. Heartworm is not transmissible from dog to dog, but it is transmissible via mosquitoes. So it is possible, even if your dog lives largely inside, for them to acquire heartworm. There unfortunately is no heartworm vaccine. The closest thing to that is a 12-month long-acting injectable called ProHeart. So we do recommend heartworm preventions for every single dog to be given routinely based off of the product you're using. If your dog does miss a dose of heartworm prevention, we recommend getting them tested and then repeating that test in 6 months to ensure they are heartworm negative. In general, heartworm preventions are considered very safe. If you have a dog that's pregnant or lactating, meaning she's nursing, please contact your veterinarian with those particular questions. Great question. So there are technically 3 publicized treatment protocols. There's a slow-acting, a 2-injection, and a 3-injection method. We do recommend the 3-injection method because it's tried and true as a 90 to 95% successful rate, whereas the 2-injection protocol is closer to 60%. And in that sort of situation, we might have to go ahead and repeat treatment. As far as the treatment particulars, usually they're on a course of antibiotics, rest, and then the treatment timeline is directed by your veterinarian. There's often courses of steroids as well as pain medications that are involved, along with further rest to prevent and reduce the risk of complications.